FORA.tv. The world is thinking.
Last night at the President's press conference, he talked a lot about health medical records and health IT as a way to make the system more efficient. Is that something that has bipartisan support? It seems to me that as well, I hear both Republicans and Democrats talk about that. So is that something that the public ought to focus on and expect to see in any kind of a reform bill?
Well, we did a major down payment on that in the stimulus legislation earlier this year, about a $20 billion investment in putting the whole nation on a new platform to have electronic health records and health information technology more generally available. And there are clearly some system savings from doing that. Partly what I think people understand is that you need to have a good electronic medical record platform to be able to do the disease management, to do the care management, to do the payment for quality that you want. And in fact, it's very difficult to do those things if you're in a 19th century medical record system. So there really is an aggressive piece. We made a major down payment. That was one of the key achievements of stimulus in terms of the health system. And we hope in all of the versions that are moving forward, House and Senate, that we're going to take that to the next level.
Well, help me with this, because this is, when I hear down payment, when I make a down payment, it's, in today's world, 25%, maybe 10, 20, 25%. How much more is needed? And is that going to be a federal expenditure to provide to, particularly to clinics and providers that may not have the resources to do it? Is there a cost issue attached to that we ought to be
initially
focusing?
Yes, but I think the general path that we're on is to initially provide incentives for providers and doctors to participate in this network, give them time to get used to that, give them an added reimbursement. However, over time, then at some point we expect them to participate, and if they don't participate, then we will give them a penalty. At that point, it doesn't become as big of a cost issue from the federal government. In fact, we will reap some reimbursements because of lower payments to those who choose not to participate in the technologically advanced system.
And that's critical for saving money in the system over the long term, but also for improving patient care. So that one doctor, so your cardiologist knows what you've been prescribed when you've gone to your primary care physician or another specialist. And sometimes right now you have one doctor prescribing something that may interact in an inappropriate way with the first prescription you're already taking. And if you don't go back to the same pharmacy, no one knows. And so we have a lot of medical errors and problems that occur and cause people serious health problems that then obviously are problematic from that perspective, but also a cost perspective. And so over the long term, we're going to improve care by having that.